Good day, everyone, and welcome to our monthly clinical nursing update. This is a mandatory requirement in each unit to be able to improve and update clinical competencies of nurses that they can use to provide safe patient care. To start with, I am Ronaldin Bangao-Ganites, and I would like to welcome all of you in this lecture. I also want to acknowledge the presence of our head nurse, our supervisors, are all energetic senior nurses, and of course, the fresh faces of the unit, our new nurses. Welcome and good day. So our topic for today's lecture is nursing management on patients with GI tract disorders. The objectives of the study are the following. At the end of the lecture, the nurse will be able to Number 1. Identify signs and symptoms that are indicators of GI disorder. Number 2. Perform independent and dependent nursing intervention and management. Number 3. Develop skills in evaluating and managing outpatient GI problems. And number 4. Explain and render health education to patients regarding their illnesses. So what are gastrointestinal diseases? GI diseases affects your GI tract from mouth to anus. GERD, diarrhea, colorectal cancer are examples of gastrointestinal diseases. When examined, some diseases show nothing wrong with the GI tract, but there are still symptoms. Other diseases have symptoms, and there are also visible irregularities in the GI tract. Most GI diseases can be prevented and/or treated. There are two types of GI diseases. One is functional and the other one is structural. Functional GI disease are those in which the GI tract looks normal when examined but doesn't work properly. This is characterized by chronic, persistent or recurring symptoms like pain and bloating that arise due to the dysfunction of the digestive tract. These symptoms occur despite there is being no evidence of a structural abnormality or disease. The structural GI disease, these are where your bowel looks abnormal upon examination and also doesn't work properly. Structural GI diseases occur because there is a change or problem within the structure of the GI tract. These structural issues can occur anywhere in the GI tract and either be acute, sudden or short-lasting, or chronic. The following are the common gastrointestinal diseases or illnesses. Number 1. Constipation. Constipation is an example of a functional problem. Constipation is the difficulty of bowel movement, or the stools are infrequent or incomplete. It is often related to inadequate fiber in your diet or a disruption of your regular routine or diet. What are the causes? Certain medication can cause constipation. Weakness, fatigue, and immobility can also cause constipation. Ignorance to the urge to defecate, endocrine disorder, metabolic, neurologic, or neuromuscular condition can also be the cause of constipation. What are the signs and symptoms? Signs and symptoms of constipation are the following: abdominal distension, there is also decreased appetite, there is purpurigness, there is feeling of fullness, headache is present, restlessness, indigestion, and there is also straining at stool. So what are our nursing management for constipation? History of onset and duration of constipation can be taken. We can also educate the patient on lifestyle changes or modification. We also have to teach the patient on techniques on how to relieve anxiety or stress coping. We have to instruct the patient to increase fiber in the diet. We can also administer enema and rectal suppository if ordered, and we can encourage the patient to practice sphincter mechanism relaxation to expel stool easily. Another type of GI disorder is diarrhea. Diarrhea are stools that are loose and watery. Diarrhea is a common problem. It may last for 1 to 2 days and goes away on its own. However, if diarrhea lasts more than 2 days, it may mean that you have a more serious problem. So what causes diarrhea? The intake of medication. Certain medication can cause diarrhea. Tube feeding can also cause diarrhea. If there is presence of infection, nutritional or malabsorptive disorder can cause diarrhea. There are also two types of diarrhea. This can be short-term or long-term diarrhea. What are the signs and symptoms? Signs and symptoms are the following: increased frequency and loose stools, abdominal cramping and distension, and spasmodic contraction of the anus. So what are your nursing management? You have to assess and monitor the characteristic and pattern of the diarrhea. We also have to assess the skin of the abdomen and the mucous membrane to determine the hydration status. We have also to encourage the patient for bed rest, increase fluid intake, and low fiber diet. We have to take note that during diarrhea, we have to instruct the patient to avoid high concentrated sugary food because this increases dehydration. The diet should be normal or that diet plus broth. The next example is the irritable bowel syndrome or the IBS. This is also called the spastic colon or the irritable colon or the nervous stomach. This is an example of functional disorder where your intestinal muscle contract more or less often than normal. There are certain foods, medication, emotional stress are some factors that can trigger IBS. The following are the signs and symptoms of IBS. There is presence of abdominal pain and cramping. There is also presence of excessive gas. Patient is having bloating. There is change in bowel habits such as harder, looser, or more or urgent stools than normal. There is also constipation and or diarrhea. So our nursing management are the following. We have to instruct the patient to avoid excessive caffeine and increase fiber in the diet. We have also to instruct the patient on the limitation of triggered foods such as the cruciferous foods, legumes, dairy, egg, and alcohol. We should educate the patient to minimize stress or learn different ways to cope with stress. We also have to educate the patient on a slow and thorough chew technique, avoiding dehydration and hydrating well throughout the day. And we have to instruct the patient on getting high quality rest or sleep. The last example that is the ulcerative colitis. Ulcerative colitis is the multiple ulceration or inflammation that is affecting the superficial mucosa of the colon. The signs and symptoms are 10 to 20 liquid stools are passed per day. There is also presence of urgent bowel movement or the sudden need to poop. There's also the presence of tenesmus or the feeling like you have to poop but being unable to. There is also mild abdominal cramping or tenderness, and the presence of hypocalcemia and anemia is noted. The following are the nursing management. We have to relieve the pain of the patient and also to maintain the adequate fluid intake. We also have to maintain good nutrition, no irritating and gas-forming food. The patient should avoid trigger foods such as dairy, caffeine, and alcohol. We also have to promote rest and reduce anxiety and then enhance coping mechanism, and also we have to monitor and prevent skin breakdowns. The following are the common diagnostic tests and nursing responsibilities. The first diagnostic test is ultrasound. What are the nursing responsibilities? Number one is to verify patient in identification and medical history, and then assist the patient with positioning for the ultrasound, and then apply gel to the skin to facilitate some weight transmission. Monitor the patient's comfort during the procedure. Explain also to the patient that the procedure is painless and non-invasive. The next is barium swallow. Nursing responsibilities are the following. We have to confirm the patient's identity, and we have to instruct the patient that NPO for 8 hours prior to the procedure. We also have to inform the patient that milkshake consistency and chalky taste of the barium preparation, and it may be unpleasant to swallow. It is also expected that the stool will be chalky and light-colored for 24 to 72 hours after the test. The test will take place for 30 minutes. And lastly is the barium enema. Restrict the intake of dairy products and to maintain a liquid diet for 24 hours before the test. We have to instruct the patient to drink 5 8-ounce glasses of water or clear liquids 12 to 24 hours before the test. We also have to educate the patient and instruct the patient to report all medications that he or she is taking, administer enemas until the return is clear also, and we have to maintain an NPO status. Cramping pains or the urge to defecate may also be experienced during the test, and we have to instruct the patient to breathe deeply and slowly through the mouth during the test. Stools will remain light-colored for 24 to 72 hours after the test. This is the end of my lecture, and the continuation of the lecture will be continued by one of our staff. Thank you and good day.